Thanks for listening to the Archbridge podcast. I am Ben Wilterdink. I'm your host and Archbridge Director of Programs, and today I'll be talking with Dr. Edward Timmons. Dr. Timmons is a professor of economics and the director of the NEES Center for the Study of Occupational Regulation at St. Francis University and is a leading expert on occupational licensing. His research has been published in numerous academic journals and has been heavily cited in the popular press by the Federal Trade Commission, the Obama White House, and the United States Senate, and in legislatures across the country. I should also note that Dr. Timmons is an Archbridge Senior Research Fellow as well. So, Dr. Timmons, thank you for joining me today.
Thank you so much, Ben. It's great to be with you.
Awesome. So I think just to kick us off, why don't you tell us, just for the uninitiated, what is occupational licensing? I think that's a good place to start, just in case there are a few people left in the country that don't know about it.
Occupational licensing essentially sets up a scheme where individuals have to get a government permission slip to work from their state legislature. And unfortunately, the fraction of workers that are impacted by this regulation has drastically grown. In the 1950s, about 5% of workers were licensed, and today that figure is more like 1 in 5. So more than 20% of workers in the United States today have to obtain a license to work. And if we think about occupational licensing and the types of professions that are affected, I think we could all recognize and we all might understand why it would make sense for physicians, for example, to get a license, to go to medical school, and to complete their residencies and meet a variety of requirements. But I think what's less understood is just the magnitude of occupations. It's been estimated that as many as 1,100 occupations are licensed in at least one state. And I think it would give most listeners pause to learn that, for example, florists are licensed in Louisiana.
Are they still licensed in Louisiana?
They are, yeah. If you want to put a floral display in Louisiana together, you still need to pass an exam. It's like an oral exam given by other florists, your competition potentially that would judge your floral abilities.
Right. I remember reading about that a few years ago, and the passage rate for the florist exam in Louisiana was actually lower than the passage rate for the state bar exam. I don't know if that's still the case, but absolutely nuts. So
absolutely, and licensing oftentimes gets put forth as a way of protecting consumers, and it's hard to come up with a public safety argument for why we should make florists pass an exam that's harder than the bar exam.
Yeah, and I'm sure that they try their hardest. Can you give us some other examples of what types of occupations are commonly licensed, or when we're interacting with people in our daily lives, what type of occupations generally fall into this category?
It's very heavily concentrated in a lot of the service industry. So, for example, barbers are licensed in every single state. Cosmetologists are licensed in every single state. Almost all states license massage therapists. It's also spread into many of the trades. So, for example, plumbers, electricians, a lot of contractors are licensed. And there's a lot more examples that are quite unique. For example, fortune tellers, and it never quite happened, but there was an effort to license pet groomers. in New Jersey. There was a bill put forth, but thankfully it never came to fruition.
So you mentioned a little bit that the reason that we have so many of these licenses, or a reason that they've kind of come into existence, is based on these public safety concerns. Is that sort of the total reason that we might see licenses? I mean, I know that some people talk about things like asymmetric information, but what's the rationale for most of these coming into being? So why are we seeing them pop up?
Well, I should clarify that what professional associations and advocates oftentimes say about the rationale for licensing, I think differs from what their intention is. So, they say one thing when they're talking about occupational licensing to the public, but they and sometimes they break. I mean, sometimes they let their true intentions known, but generally there's this disconnect. Oftentimes, advocates for licensing will make the argument that licensing is necessary to make sure that the public doesn't get served by incompetent practitioners, or practitioners perhaps that haven't met some bare minimum quality standard. And as you mentioned, this idea of asymmetric information, that we as consumers don't have access to the same information set about the practitioner's credentials relative to ourselves, and we don't know exactly what the professional has done with respect to their career, or how they scored in their entrance exams and so forth. But there's also this competing effect, and I would argue is the driving force behind occupational licensing, and that it's its anti-competitive effects on the market by essentially making it harder for new barbers or a new florist or new contractors to enter the market. You're essentially reducing competition in the marketplace, and you're presenting yourself with an opportunity to potentially charge higher prices than you could otherwise.
Right. Yeah, that makes a lot of sense to me. I mean, this kind of reminds me of the old bootleggers and Baptists dynamic. Are you familiar with that sort of way of describing this?
That's exactly right, and that's an excellent way of framing this.
Can you describe that a little bit for people who may not have heard about that?
Sure. So the bootleggers and Baptists theory goes back to the preponderance of dry laws, and there were religious individuals who argued for these laws on morality grounds. To prevent individuals from consuming demon drink, at certain times of the week, or on Sundays, and those that were producing liquor illegally or transporting liquor illegally, they benefited from this because essentially they were the only game in town. Operating on those days or on those particular moments when liquor wasn't sold. So essentially they had a monopoly on the liquor market on those particular points in time. So the bootleggers financially benefited, whereas the Baptists on moral grounds got what they wanted. So you had kind of this unique group of individuals, this consortium of individuals who were both arguing for the same thing. And I think with licensing, I think the professional associations almost try to be the bootleggers and the Baptists at the same time. It's kind of a unique dynamic because they have a public face where essentially they're making the classic Baptist argument where we're doing this because we want to protect the public. We support the consumer. We want to make sure the consumer is protected, but at the same time, from the licensing laws, they financially benefit because essentially they're able to restrict competition and charge higher prices than they would otherwise.
Right. And then that in turn both creates barriers for entrepreneurs who might want to get involved in those fields or in those services. And it also drives up the costs for consumers to pay for those. So obviously it's sort of a negative, net negative, for both consumers and entrepreneurs. But the providers seem to be benefiting, so they're interested in keeping this going and trying to get more licenses passed, for different things like that. So, okay, I think I kind of understand this dynamic. I think most people can kind of see what's happening here. This seems like a textbook example of regulatory capture, where basically the business interests are using this governmental lever to protect themselves and enrich themselves. So I've been working in this field for almost 10 years now. I know you've been studying occupational regulations for quite a while. So what has been happening in the past few years? Obviously, you said that since the 1950s, these licenses have grown. But I know that at least in the past few years, there's been some push to get them rolled back a bit. So can you talk about that dynamic or what you've seen in how people are responding to these licensing rules?
Absolutely, and I would say within the last 5 years, the tone has changed, and state legislatures have recognized that this growth in occupational licensing presents significant costs, and we need to take a step back and reconsider whether or not occupational licensing is always the appropriate policy tool. I would demarcate, the significant change with respect to state legislators actually coming out of the tail end of the Obama administration. In the summer of 2015, the Obama White House put out a white paper that essentially summarized what we as economists have known about occupational licensing for quite a while. And they did a really nice synopsis of essentially what we've learned and what we understand about occupational licensing. Namely, as you said, occupational licensing raises costs for consumers, and it potentially restricts entry. And unfortunately, we don't have a lot of evidence that it serves its intended purpose of improving quality. So thankfully, a number of states have taken some significant action. I'll highlight a couple of those. Arizona was the first mover on universal recognition. And a problem with occupational licensing is that it potentially restricts individuals from moving from one state to another. What individuals will find is that they might be licensed as a barber in Pennsylvania, and they want to move to Alaska and begin cutting hair, and they'll find that their license doesn't necessarily transfer. They might have to go back and take another exam, or they might have to jump through a bunch of other hurdles in order to begin cutting hair, something that they've been doing and know everything about back when they were living in Pennsylvania. So what Arizona did is they passed the nation's first universal recognition bill. And essentially what this law does is it says if you're licensed in Pennsylvania as a barber and you move into Arizona, we're going to recognize your license, period. As long as your license is in good standing, you have to pay the fees and so forth, but you're not going to have to go back and retake the exam and document your barber school scores and all that sort of thing. You're going to be able to start working in Arizona immediately. And 2020 was a tough year for all of us, I think. But thankfully in 2020, two more states followed suit and passed similar legislation to what Arizona passed. Both Iowa and Missouri passed universal recognition laws. Iowa's actually goes one step further. Iowa's law, if, for instance, you're working as a massage therapist, let's say in Vermont, Vermont does not license massage therapists. So if you're working as a massage therapist in Vermont and you can document experience, you can potentially work in Iowa as a massage therapist, even though you haven't completed licensing. So that was a really significant reform that Iowa enacted just this past year.
Wow, that's great news. You got to think that that's a huge competitive edge for states that are trying to make themselves more attractive to pull in more people, and obviously people are moving around. That seems super helpful. I've seen a handful of other states I know have considered this or that. One of the other reforms that I've seen states adopt are sort of these rolling reviews, and so they'll kind of go back and they'll check periodically over the course of 5 years or whatever increment of time. They'll check a certain percentage of however many licenses, and they'll make recommendations on that. So I know that that's another reform that's sort of been out there. It kind of seems like the universal recognition has been gaining more steam, and maybe that's the better way to go. So I mean, can you touch on some of the other reforms like the rolling reviews, and specifically get into, I know a lot of states that have adopted those reviews and they're expecting staff usually to make recommendations. They're working off of what we might refer to as the inverted pyramid of consumer protection. So can you talk a little bit about those reforms and what that pyramid means?
Sure. So you're absolutely right, Ben. There have been a number of states that have enacted these types of reviews. Nebraska's one of them. Ohio has also enacted this type of review, and Mississippi is as well. Mississippi is a little bit different because essentially it's a 3-person committee that will be tasked with reviewing occupational licensing in that state. And when we're thinking about how effective this reform will be, I think it's probably too early to say. I mean, I think it's fantastic that the states are doing these reviews, because there's definitely a lot of rigidity with occupational licensing. Once licensing is passed, unfortunately, it has a tendency to stick around. I mean, like many other laws, to be perfectly honest.
Right.
I think what matters a lot is, are the reviews essentially insulated from some sort of capture? I think that's the critical aspect, and I'm optimistic. I mean, I'm very hopeful that these types of reviews are going to, in fact, be effective, and there'll be a careful reconsideration of licensing some of these occupations. But I think right now it's probably too early to say, and I look forward to seeing what comes out of these states' reviews.
Yeah, I hope that we get some good stuff from that. I know that they've only been in place, even the longest states that have had them are still working that way through the process, and so we'll see. But as states are reviewing them, they are often referring back to that inverted pyramid of consumer protection. So can you describe that a bit, and like what are they looking for when these different reviews are happening? What criteria are they using to sort of evaluate how they're going to make their recommendations?
Thank you. Yeah, I missed that part of the question, Ben. I apologize, but with occupational licensing, my wife accuses me of the same thing. Sometimes I just hear what I want to hear, and I just don't listen. So I'm sorry. But with
we all do
that. with occupational licensing, I think, unfortunately, there's a misunderstanding about it. A lot of people think that occupational licensing is synonymous with regulation. That if we're going to regulate a profession and try to protect the public, that licensing is the only way that we can do that. And that's just completely false. And the Institute for Justice, I think, did an exceptional job of breaking down that there are alternatives, that there are less costly alternatives to occupational licensing. So they came up with this concept of the inverted pyramid, and at the top of the pyramid, the top of the inverted pyramid, you would just have market competition. So essentially, the market in of itself can regulate. I mean, if I'm a barber and I am continuously just hacking other males' heads or other customers' heads, I'm not likely to be in business for very long. The market's going to discipline me if I'm providing poor quality service. And that only gets amplified by the addition of online reviews. We as consumers have access to a lot more information now than certainly when these laws were written. So we know a lot more about the reputation and about the credentials of a service professional than what we did 50 or even 20 years ago. And there's other options in addition to market-based competition. We might find that it makes sense to require a service provider to obtain a bond. If there's some risk, for instance, if I hire somebody to cut down a tree and there's some risk to my neighbor that my neighbor's property might be damaged, we might want to have that tree trimmer have a bond to cover instances like that. We have registration requirements. We could collect the names and the contact information from professionals if we're worried about fly-by-night service providers that disappear. That would be one way that we can protect against that. We could use random inspections. That's what typically gets used in the food services industry. Chefs aren't licensed. We use this random inspection system to make sure that the back of restaurants are relatively clean. We can also have the private sector have some system of certification, like we do with mechanics. An individual, if they want to show a customer that they have some sort of credential or they pass some sort of bare minimum quality standard, they can show them that they're in fact a certified mechanic. So there's a whole host of regulatory options in between market competition and licensing. There are a number of other ways that we can potentially solve some of these costs to consumers or potential market failures that don't involve the most costly, most draconian regulation of occupational licensing.
Yeah, I think that's a really important point to highlight. I know that just personally, when I talk to people about some of this issue, because I'm a nerd and I bring it up often, the response is, you just want a wild, wild west where businesses can, take consumers, to the cleaners and all this stuff. And, you just have to remind them, no, there's a whole host of options in between, nothing at all. And even nothing at all, like you said, with like reviews and different things like that, it's not really nothing. But even still, exactly. No direct government regulation to licensing. There's a whole host of different things that you could do in between there. And I think about that sometimes. What are we gonna license a busboy to make sure that they can clean the table properly? I mean, that's what you're eating. That's it's kind of kind of ridiculous. So I'm happy to hear that at least that idea is getting out there a little bit more. I think people are understanding that a bit more. So I would say that that's definitely good news. We are solving those problems and some of the potential externalities and things like that. So I wanted to get into a bit more on the effects of licensing, because you've done several studies for the Archbridge Institute throughout the past few years. We've had the privilege of working on a few states, together on certain things here and there. But one of the seminal pieces that you've done for Archbridge a couple of years ago now was a report called Too Much License. And you were specifically looking at licensing in relation to economic mobility and income inequality, both issues that we care a lot about, and I think a lot of people care a lot about. So can you talk a bit about that report and what you and your co-authors looked at and what some of your key findings were?
Absolutely, and thank you for that high praise. I was very happy to partner with the Archbridge Institute, and I'm very happy to be associated with the Archbridge Institute. So what we did in our study is we looked at growth in occupational licensing for lower income occupations. So occupations like barbers and cosmetologists and massage therapists, occupations that oftentimes can represent that first rung for individuals that are looking to better themselves, looking to find gainful employment and begin achieving their small piece or perhaps their large piece of the American dream. And what we did is we looked at the time period of 1993 to 2012. And we looked at this on a state-by-state basis. And essentially what we did is we counted up the number of newly licensed occupations over that period of time for every single state. And what we found is that on average, states added licensing requirements for 31 occupations. We were kind of surprised by that. Now that was a pretty significant number. Even more significant, though, was the differences across states. Two states in particular, Arizona and Louisiana, added more than 50. Arizona added licensing requirements for 54 low moderate income occupations. Louisiana, the state that licenses florists and continues to license interior designers, they added occupational licensing for 59 occupations. On the other end of that, you had Oklahoma and Kentucky add licensing requirements for just 15. So, a pretty significant disparity there between those two states. So what we stopped to ask is we said, well, we see these big differences across states with respect to the number of occupations that they're licensing. Is this potentially having some sort of effect on economic mobility and income inequality? Raj Chetty has done some very nice work with putting together a data set that tracks parents and their children so that we can better understand if children are in fact doing better than their parents. And we used that data set. And what we found is that looking at those two groups of states, so looking at Oklahoma and Kentucky on one end and Arizona and Louisiana on the other, those two ends of the spectrum, economic mobility did unfortunately fall in all of the states, but there was a big disparity. Economic mobility fell by 1.6% in states like Oklahoma and Kentucky, but fell by 6.2% in Arizona and Louisiana. So it seemed as if there was, in fact, a negative correlation between growth in occupational licensing and economic mobility. And then we took a look at income inequality. We used the Gini coefficient, which is a very commonly used measure of income inequality. And what we found is, again, comparing states like Oklahoma and Kentucky to states like Arizona and Louisiana, we found that income inequality rose by about 3.9% in those states that only added 15 licensed occupations versus 15.4% in states like Arizona and Louisiana. And if we stop to think about it, I mean, it's not all that surprising, because what occupational licensing essentially is doing is it's limiting the pool of opportunity that individuals can choose from. Individuals might look and say, well, oh my gosh, I have to complete 2,000 hours of education in order to work as a cosmetologist, or even a hair braider, unfortunately, still in some states. And what those aspiring entrepreneurs might say is, I can't do it. I can't afford that. And they'll go to their second best or third best option. So it's not that hard to connect the dots and understand why there might be a relationship between occupational licensing requirements and economic mobility and income inequality.
Yeah, I remember looking at those results and being pretty surprised at how dramatic some of those differences were. Definitely, I know it wasn't like exactly causal, one, causes the other, but it very much stands to reason that when you shrink people's opportunities and you enrich a small group of people and exclude others, you might see some of these effects that we're seeing. So that was a really helpful piece of research. And, we continue to use it and sort of highlight that across the states, that this isn't just another regulatory issue to look at. This is actually something that is hurting the American dream across generations and actually increasing income inequality. So really happy to have that out there, and we'll continue to focus on it. But shifting gears a little bit here, you kind of alluded to this earlier, but obviously 2020, COVID-19, a lot of things happening with medical professionals, a lot of movement across the states. Obviously, those occupations have more instances of licensing than a lot of other occupations do. Can you talk a little bit about how states responded to COVID-19 in terms of licensing, and what kind of movement we saw there, and just what all happened, and whether that or not that's permanent or good or bad, or what was going on there?
Absolutely. I think there are a lot of things that policymakers got wrong with COVID, and I think we all recognize that. But one area where policymakers, I think, really got things right, and should be applauded for how quickly they responded, is policymakers were very quick to recognize occupational licensing for medical providers from other states. And this was particularly important very early on in the pandemic, where you had these pockets of high incidence of COVID, like in New York City and in New Orleans. And the ability of nurse practitioners and physicians and other medical providers to move to those hotspots was extraordinarily important. We also saw a number of states temporarily allow medical providers to practice to the full extent of their training. It almost seems absurd, but to this day there's still too many states that won't allow nurse practitioners to do what they're trained to do. They won't allow physician assistants necessarily to work to their fullest potential. And during COVID, recognizing the dramatic need for an all-hands-on-deck approach, a number of states very quickly allowed these additional medical providers to work to their full extent of their training and help out where they could. I think we're still essentially on the waiting to see if in fact these reforms will become permanent. I can tell you that Massachusetts did in fact grant nurse practitioners full autonomy. That they had a temporary rollback, and just early this year, Massachusetts did in fact allow nurse practitioners to practice to the full extent of their training. And I think we'll have to wait and see. I think definitely a lot of the arguments that oftentimes get made is that, well, this state's different. My state's different, and I don't care what these other states are doing. Those types of arguments I don't think will be feasible anymore because, at least for a period of time, the state operated in an environment where they would accept out-of-state licenses, or they would allow these additional medical providers to work to the full extent of their training. And one has to wonder, why can't that just be the new normal?
Yeah, it seems like it's going to be difficult for policymakers that want to try to put that genie back in the bottle. I don't know. I think as people are paying attention to that, they're going to ask the same question that you just asked right now. Why do we need that? I know, where I am up here in Alaska, it's an extremely rural state. It's an enormous state by landmass. We don't have that much population, but telehealth is huge. As more people are getting connected in the internet, they can take advantage of some of that. But there are only so many in-state providers for that. So, I mean,
right.
Just in this pandemic, I know loosening some of those laws and allowing the telehealth, we can talk to people in Seattle or, wherever, and get plugged in with providers across the country. And that, it just seems like common sense. Why wouldn't you just let that happen? Just in general.
Particularly in rural areas. I mean, we had all kinds of challenges prior to COVID. It was not as if it would be easy to potentially see a primary care provider, even when we didn't have all the stresses and a huge increase in demand following this pandemic.
Okay, well, I'm glad we got to talk about that a little bit. I hope that some of these reforms do have some sticking power after some of these more emergency things subside. But kind of switching gears a little bit, right at the end of last year, the Trump administration released an executive order on occupational licensing. So can you explain what that order was and sort of what the effect of it might be, or what we can expect? Because as we've been talking, most of these issues are at the state level, so it kind of seems like the federal government doesn't have that much jurisdiction here. So just talk a little bit about what that order was about and what, if anything, might come from it.
You're absolutely right. By the way, where the action is at on occupational licensing is at the individual states. But I welcome the executive order from the Trump administration. The way that I would interpret it is it's almost like a playbook to say of what would constitute taking a serious look at occupational licensing reform, and it suggested the states that they should consider allowing universal recognition of occupational licensing, that when states are thinking about using occupational licensing, they should refer to the inverted pyramid. They should use the least restrictive means, the least costly means of making sure that consumers are in fact receiving good quality service. And I think it's really up to the states now to look at this guidance. And the beautiful thing about occupational licensing is that it should be, and in many cases is, a bipartisan issue. It's something that the Obama White House has put out a white paper on, and it's something that the Trump White House put out an executive order on. And moving into the Biden administration, there haven't been any formal declarations, but certainly on the campaign trail, Biden expressed his concerns about growth in occupational licensing and encouraged states to look to enact reform. So I'm very hopeful. But, as you said, Ben, it ultimately comes back to the states. States have to take all of this great information that they have, and they have to move forward. They have to carefully reassess the state of occupational licensing in their state and make sure that it's serving consumers and not holding back potential entrepreneurs and crushing entrepreneurs from getting started.
Yeah, I think it is encouraging that we're seeing, from Obama to Trump and now, like you said, to Biden, it does seem to be very bipartisan. Even in the states, a lot of these reforms are very bipartisan. It's just these sort of entrenched interests who have quite a bit to lose, that seem to be kind of pitting against a pretty diverse, ideologically at least, coalition of people who are taking these reforms seriously. So yeah, we'll see what happens, but it definitely is encouraging, from where I'm sitting as well, that it is one of the very few things that does seem to be genuinely bipartisan across the country right now.
Absolutely.
Well, I wanted to get a little bit more in the weeds on some of the licensing questions here. So, you've been studying licensing for years and years. I know you've been traveling across the country and looking at lots of different aspects to it. Are there any occupations that you think should be licensed? And what are they, if so?
I think if you're going to make an argument that an occupation should be licensed, I think probably physicians would be near the top of that list. But even when we think about physicians, the requirements to become a licensed physician are essentially uniform, whether or not you want to be a family care provider or a brain surgeon. There are a lot of additional private entities that ensure that surgeons are in fact good quality. They have to, for example, get operating room privileges. They have to become board certified. And they have to ultimately make sure that they're meeting the objectives and the requirements of insurance companies. So there's all sorts of private hurdles that do a lot more than what physician licensing does. I think there's probably good arguments that can be made on both sides, I think, for some of these higher end professions, where an individual professional really does have your life in their hands. But I think at the very least, coming to the middle in many respects, I think there needs to be some careful reconsideration of physician licensing requirements. Does it make sense to require a family doctor to meet exactly the same requirements as a brain surgeon? And I don't think it does. I don't think it makes sense to subject a family professional or a family healthcare provider to the same licensing requirements as a heart surgeon or a brain surgeon. So even there, I think that there's a need for a careful, thoughtful discussion about these licensing requirements.
Yeah, I'm laughing a bit because I can hear somebody taking your comments and saying, you know what, you're right. Let's make it really hard for people to be like heart doctors and brain surgeons. Now they need more licensing than just the family doctor. But yeah, that makes sense. I think your point's well taken. I think that always comes up as when I hear some pushback from this. What about doctors? What about physicians? Things like that. And I think from my perspective, I think there are some good reasons to still scale it back for those professions, and some of which you just covered. But I'm not going to cry about it if a state decides to delay or just omit physicians from their broader reforms. I mean, we're talking about so many professions, like you said, in even in states like Louisiana, we're talking about florists and interior designers. So there's a huge range between something like that and a brain surgeon.
That's
so
right.
I guess there is a pretty high variance there.
The Brookings Institute, of all places, has put out a number of pieces advocating for the deregulation of lawyers. And, if we think about it, with advancements in technology and, these websites that allow you to make your own last will and testament, I don't think that, all of the services that are provided by lawyers necessarily should be subject to licensing. And in fact, I did a paper a number of years ago where we looked at occupational licensing of lawyers in Europe. And there's a handful of countries in Europe where lawyers don't need to be licensed. They have a certification system, essentially, where if you want to use certain titles, you have to pass certain requirements. But if you want to provide legal services in those countries, you don't have to be a licensed lawyer.
Yeah, I think that's a model that we should take really seriously. That's interesting. I'll see if I can dig up some of those Brookings studies and put them in the notes for this show so that people can look at that as well. Well, I want to kind of switch gears a little bit here now to talk about you a little bit more in particular. So as I mentioned at the outset here, you've been working on this field for a really long time. And you now direct the Center for the Study of Occupational Regulation. So when and why did you get involved in looking into some of this stuff? Where did that come from?
Yeah, that's a good question. Why on earth would somebody want to spend their academic career like digging into like these arcane things like what Louisiana requires to become a barber? When I was in graduate school, I had the great fortune of reading Capitalism and Freedom, and reading the section of Capitalism and Freedom that dealt with occupational licensing. It was like a light bulb moment, and I was fortunate that I had a wonderful academic advisor at Lehigh University, Bob Thornton. Who was one of the first academics to really dig deep into occupational licensing. He did a real early study on the licensing of barbers. And when I came to him and said, I'd like to do my dissertation on this topic, he didn't say, well, what are you, nuts? Nobody cares about this topic. He said, let's do it. It's time for somebody to take another look at this. And through him, my academic advisor Bob Thornton had the same academic advisor as the nation's leading expert on occupational licensing, Morris Kleiner. So I was very fortunate to connect with him, and he's been a great mentor. My advisor's been a great mentor. And thankfully, I was fortunate enough to have two very great economists to work with and look up to, and try and continue to bring more attention to this important topic.
Yeah, I think that's great. I know as you've been doing research on this stuff, you've had the opportunity to open up the Center for the Study of Occupational Regulation. And I know that's only just a few years old now, but it seems like every time I check in on you guys are growing. So can you talk a little bit about the center, sort of what's your goal there, and what have you guys been up to, and maybe what do you guys have sort of on the agenda for the next couple of years?
So, what I saw in this area was a need for there to be more data on occupational licensing, and also just a need for there to be a clearinghouse, if you will, for everything related to this topic. So, what we try and do at the center is, number one, we're working on building this national database of occupational licensing laws. We have about 250 occupations in it right now, so we're getting closer and closer to documenting all 1,100 occupations that are licensed in at least one state. And we have a network of researchers that are doing work in this topic. And we're trying to encourage more researchers to engage and look at this topic and explore. We know a lot about occupational licensing, but we don't know everything. So, trying to look at some of these questions that we don't necessarily have definitive. I mean, when we think about, for instance, quality can be hard to measure, admittedly. So, trying to more definitively get a good understanding. The data that we have is quite clear, but it certainly would be good to know more so that we can better assess what the costs and benefits of occupational licensing are. And what we're working on, what we hope to do is we hope to be a resource for states that are interested in taking a hard look, because we recognize, reading and learning about occupational licensing isn't the most exciting thing. I think it is. I enjoy it, but I recognize that not everybody is going to be in the same mindset as me. So we want to serve as a resource for states that want to take a careful look at occupational licensing and better understand how their laws stack up to other states. Or potentially if a state is thinking about letting nurse practitioners do more than what they're currently allowed, letting them know, no, you won't be going out on a limb. I just submitted written testimony to Virginia a couple of days ago, and in Virginia, currently, if you want to work independently as a nurse practitioner, you have to have 5 years of clinical experience. Well, as it turns out, in Maryland, you only need 18 months. And in Washington, D.C., you don't need any additional clinical experience beyond what you obtain from your licensing process. So, just letting legislators know that, these are the facts. That this is how your state stacks up to surrounding states, and making it clear that there's no need to be concerned about going out on a limb and the wild west, as you said, from enacting some common sense reform.
Yeah, I'm glad you guys are doing that. I think that's super helpful. In my experience, states, working with state lawmakers across the country, states are the lawmakers are generally very reluctant to be the first to do something, yes. Or if they feel like they're the first, and so having this resource, I think is super helpful. Well, I just have two more questions for you before we close out here. My first one, you sort of touched on a little bit, but if you could somehow beam information into their brains, what is the one thing that you would want every state lawmaker across the country to be aware of when it comes to this issue?
When you want to get good information about occupational licensing, let's say occupational licensing of music therapists, let's say, don't just talk to the music therapists. Talk to some other folks. get some other perspectives, because unfortunately, the music therapists have a very clear financial incentive to require licensing. They maybe they are in fact looking out for consumers. It could very well be, but they will financially benefit from the licensing. So, there needs to be another voice. There needs to be a careful consideration of both the costs and the benefits of licensing, and place the onus on the group that's requiring or that's advocating for licensing to make the case that there is in fact a cause for harm or a potential for harm if the license isn't issued, and ask them why we can't use some less restrictive type of regulation. If we could do that, I think we would be in a lot better place today.
That's a good answer. I tend to think you're right, looking at all this stuff. So I appreciate that. Okay, well, my final question here to kind of close this out is something a bit more hopefully active. One of the best things about licensing is that it is on the state level. At the Archbridge Institute, we're all about lifting barriers to people succeeding, and licensing is, kind of one of the more obvious barriers that's out there. So because it's at the state level, a lot of these things are more accessible to the average person than a lot of federal legislation. So if there are people listening or who are thinking about this, maybe they're civically minded, what advice would you give someone who's sitting in a state right now thinking, I wonder what my state's licensing looks like. I wonder if I could get involved in sort of rolling this back. Where would you suggest that they start, and how would you suggest that they go about getting more informed and more involved in this process?
Yeah, that's a very good question. I mean, I think, certainly you could take a look at our database on csorsfu.com. We have licensing requirements for a large number of occupations, and the Institute for Justice also has great websites that allow you to get a good sense of what licensing looks like. If you're concerned about occupational licensing and its growth, a lot of times with licensing boards, the public member seats will be vacant for long periods of time. And, if you want to have an opportunity to make your voice heard and, potentially prevent occupational licensing perhaps from becoming stricter than what it should be, I think becoming a public member of a licensing board would be one great way to do that. Or, simply contacting your local legislator and letting them know that this is something that you're concerned about. I think that would be a good first step. It's amazing how impactful that can be. Just making that phone call and letting the legislator know that you're concerned that licensing is in fact holding back entrepreneurs.
Yeah, I know state lawmakers in particular very much keep tabs on that and are very responsive, generally speaking, to their constituents. So and those boards, I've seen it myself. They're often very just open. They're just vacant. There's seats on there. You can get involved. So, well, I appreciate you going through that. Ed, thanks for coming on with me today and going through this issue. I know here at the Archbridge Institute, we'll continue working on it at the Center for the Study of Occupational Regulation. I know you guys are going to continue working on it. We're headed in most states, I think in 2021 by now. We're recording this on January 28th, have begun their legislative sessions. So hopefully there's going to be some positive movement this year and into next year. So Ed, thanks for coming on today and talking with me about it.
Absolutely. Thank you so much, Ben. Great talking with you.
All right. Until next time.